multi-segmental extension, breakout, a quick recap. Go ahead and arms over your head. Go backwards for me. Okay, she gets 170 degrees. Spine doesn't clear her heels. ASIS, looks like it clears her toes. So good there. So it doesn't clear her heels. She gets 170 degrees. So we have non-uniform curve, kind of dumps there. Okay, so she's dysfunctional, non-painful. We're going to break this up. Okay, so the first thing we're going to do is we're going to move basically all the body parts, and we're going to remove all the stability requirements. Okay, so we're going to place her prone in a press-up position. Okay, so you're just going to lie prone, and first we're going to take away. We're going to have her do an active extension and lying, right? So we're going to have your thumb lined up with your clavicle. And I want you to try to keep your hips on the table, and I want you to do a press up for me. Go ahead and do a press up for me. Okay. And ASIS is here. Okay. Here's your pad. Okay. So this pad is usually 2.5 inches. ASIS is here. So if it goes beyond 2.5 inches, that's going to be dysfunctional. Okay. So that should be lower than 2.5 inches when you do a press up. The other thing is you want to make sure you have a uniform spinal curve, which doesn't look too bad. It looks like right here it kind of honk. Again, right here it kind of is really a sharp curve. So this would be dysfunctional. Okay, so that should be lower than that. So she goes beyond that 2.5 inches. Okay? So if she came in and she did this, right? Because what you need with extensions, you need spine extension, you need hip extension, right? And you need shoulder flexion. So if she came in and she passed this part of the test, right? Then you would just skip right to the upper extremity portion. You don't need to do anything with the spine. But since she came in, she did not fall within that 2.5 inches. She did not have a uniform curve, especially she didn't fall between 2.5 inches. We need to break out the spine. We're going to do you need to do the lumbar lock, one, okay, and then you're going to have to do the prone on elbows, depending on what you find in the lumbar lock. So I don't want to confuse you. So since we did it on Michaela, I want to do it quickly on Katie, okay? And I'm just going to do one side. Okay, so go ahead and get the lumbar lock position. And come over towards me. Okay, so your elbow's in there. Perfect. Your head just be a nice neutral position. Can you put the left arm back here? Okay, so this is lumbar lock. So what I want you to do is go ahead and just rotate your head here. Now pretend you're in a barrel, okay? And just rotate your head to the left and lift this arm up to the ceiling. Okay, you're supposed to get 50 degrees. Okay, doesn't look like she's getting 50 there from this angle. Do it one more time. Okay, she can't really get 50 degrees, okay? So now I'm going to do it passively. So I'm going to block her here, reach in between here, grab her shoulder. Now I'm just going to go ahead and push her up. What do you see in there? Looks more than 50, right? Feels more than 50. Okay, so we can get more than 50, okay? So that would be a mobility dysfunction or a stability motor control. That would be a stability motor control dysfunction, okay? Since that's a stability motor control, and extension and rotation in the spine are coupled, right? And so, since this is not a mobility issue in the thoracic spine, and for time's sake, I'm not doing the other side, but believe me, it's the same, right? Then we'd go down and we'd assess the lumbar portion and see what kind of motion it has there. If this was a mobility dysfunction, we really can't do this portion of it, okay? And I'll tell you why in a second. So this is stability motor control of thoracic. So now I'm going to unlock the lumbar spine, which was previously locked. Okay? So we're going to do a prone on elbows, extension, rotation. Okay? So I'm going to have you just kind of move up a little bit, extend your legs, and then keep the arms in the exact same position you had it in. All right? So we're going to be in this position now. Okay? Now we unlock the lumbar spine. So when we do this rotation, we're assessing mainly the lumbar spine. Now, 30 degrees of rotation comes through the lumbar spine. 20 of it comes from your thoracic spine. So that means only 10 degrees, 2 degrees per segment, come from your lumbar spine. So if this was a mobility dysfunction, and it wasn't moving properly, right? It's somehow stuck or whatever, it's not moving properly, then if we would go ahead and continue with this one, we would almost be certain that we're going to find this to be mobility dysfunction, right? Because of this. So it's going to give you a false positive, right? So normally we have to work on this, improve this, get this moving 50 degrees, and then we can come back and assess this. Luckily with Katie, she's a stability motor control up here. So now we can continue down to look at the lumbar spine. Right? Usually if it's a stability motor control here, usually it's going to be a stability motor control here. But we want to make sure. Right? So to do so, I'm going to have you, same thing, put this right hand in the small of your back, and then again, you're going to pretend like you're in a barrel, right? And you're going to lift up, and now we only need about 30 degrees. Go up again. Ooh. I don't know about that. One more time. That's close. That's close. I don't think she's getting it, but might, okay? So if it's close, I'm going to still do it passively, right? But I don't think that was 30 degrees. A little different blocking mechanism here. So with this one, I'm going to block her right shoulder with my right hip. I'm going to come here and just hold down her pelvis so she can't do this, right? And then I'm going to reach around and grab here, okay, in this position. So from here, relax for me, I'm going to pull her up. And when I pull her up here, now you can see I can pull her well beyond 30 degrees, right, compared to before. So she would be a stability motor control of the thoracic and of the lumbar, all right? So that's the spinal segment. Now we move from there, just keep that in mind. Now we're going to move to shoulder flexion because we need 170 degrees of shoulder flexion, okay? So to do so, she's in a perfect position. So we're just going to come off the edge of the table, leave your arm dangle. In this position, all I want you to do, Katie, is I want you to take, and let me get a top of your head. You're going to say, take this arm, and all I want you to do is go up over your head as far as you can go. And then come on back down. Do it again for me. Come back down. One more time. Pretty close. I'll probably give it to her. And then if you're an adult, you can take it passively. Okay. Stops right about there. Close to 170. I think we should be good to go there. All right. So that's flexion. Now the other thing we need is we need at least 10 degrees of hip extension, right, to pull this off. So what we're going to do is I'm going to have her go and lay on her back for me. And to assess whether she has 10 degrees of hip extension, you can do it actively prone or passively prone, which we'll get to. However, through the SFMA, they have 2 special tests that we've learned throughout your education, right, that we can complete on her to see if she can even get to 0 degrees. Okay, so the first one's your favorite, flexion, abduction, external rotation. The second one's modified Thomas. Okay? So with the favor, what we're going to do is we're just going to go ahead and cross the leg over this leg, flexion, abduction, external rotation, and we're just going to kind of hold her pelvis down so she can't pop up. And we're just going to slowly just lower that leg down to the table as far as you go. Okay? And you're going to hold it there, and then you're looking at how many hand widths. She doesn't. It should be 2 hand widths, right? So really, it should be down here, right? She pops up a little bit here, so it's not quite 2 hand widths down. So that would be dysfunctional on the right. We do the left, bring it up here again, stabilize, let it drop, and that's even a little tighter, right? So that's about 3.5 hand widths off the table. So she's dysfunctional when it comes to that. Now, favor is more joint related. It's SI and hip, right? And modified Thomas is more soft tissue. So we're looking at the modified favor being positive. Okay, so she doesn't get down to 2 hand widths. So right now, you need to have a negative favor and a negative modified Thomas in order to even do the active and passive. Right? So right now, I know in my head I'm not going to even do the active and passive because she has issues even getting to 0. So with this structure here, we're going to do then after that, we're going to do a stabilization because again, the pelvis might not be oriented properly. So what we're going to do is I'm going to have you do the same thing you did before, right? Arms up here. I'm just going to bring this up like so. Now I'm going to go ahead and have her pushed into my hand, tighten up the core, and then we're going to have this kind of drop down again. We're going to see if that improves it. Okay, still not 2 handless away, right? Come on back up, relax your arms. We're going to switch. Okay, so this is stabilizing. Keep it up there. Push against my hand. Okay, drop it down. Set far from the table, right? And relax for me. So again, still that restriction there. So still some kind of SI mobility issue going on there. Okay, so we did the stabilization, it didn't change orientation, didn't change motion. Okay, so now we're going to go to that modified Thomas test. Okay, so I'm going to have you actually flip around here. Now I want you to come off the table and just sit, just so your gluteal folds on the table. There you go. Now go back, bring both knees up to your chest, just like so. Okay, again with this one, we're going to, I can take it, we're going to find that happy spot, right? You don't want to be way up here, that's going to be a false positive. You don't want to be way down here, that's going to be a false negative. So you want to be in that neutral spot, so you want that sacrum to be flat against the table, so I rock it. So I find that neutral spot, and then from there, I normally would just put the leg on my chest. Okay? Otherwise, if you have them hold it, they'll probably pull it up or down. And then we're just going to drop this leg down, like so. Okay? And so, again, this should be parallel to the floor. It's not. So you're thinking, what structures could be tight? It could be your rectus femoris, you know, those kind of structures that you're testing here. Or not rectus femoris, I'm sorry. Your psoas muscle. Right? And then your rectus femoris, this should be 90 degrees. You see how the knees popped up. So again, that's probably more rectus femoris. It's pretty nice in line. Sometimes if it's rotated more out here, you have your TFL pulling on your IT band. So you're looking at different soft tissue structures. Okay? So this could be basically a mobility dysfunction of hip extension if you have this, right? Because some kind of, so it could be tight structures here, it could be neural issues, fascial issues. And I'm sure she'll have the same on the other side. We're not going to test it, but probably. So with her, I won't even go to the active and passive portion. But let's say her knees dropped down to the table. Let's say she did this and she had all the way down 90 degrees, no problem. Now we're going to do the active and passive. I'll show you how to do that. So let's go prone, head down to the other end. Forehead. So here, you move a little bit more toward me. There you go. So we're going to look at active range of motion. It's really tough to decipher between hip and lumbar spine with this. We always use our lumbar spine so much, so you just got to be careful of that. So what I'll normally do is I'll reach around, feel her ASIS when she does it, okay, and I'll try to stabilize here. And what I'm going to have her do is just, and this is if she passed the other two tests, right? I'm going to have her go ahead and lift that right leg and go back down for me. And now, as soon as you feel that ASIS pushing against your hand, dropping down, that's where you stop it, okay? Because that means she's taking her pelvis, she's doing this. They shouldn't do this. You should be able to get 10 degrees without that ASIS popping down in your hand. Not that occurs immediately. So go a little slower for me. Right there. Stop. So I see it right away, just boom, into your tilts, right? And so, again, I feel it right away. So she doesn't even get like hardly any movement, and you feel that, right? So after that, let's say she can't do it. Actually, it pops down. I can reach over again, and I'm going to kind of grab her leg like so. And I'm going to go ahead and just lift it up. And I'm going to see, right? Bad thing is sometimes our whole thing kind of shifts. So stay on your side for me. That's a little better. I'm not feeling. There it is. So right there, I feel it. That's close to 10 degrees. Hard to judge that, right? But when she does it actively, do it actively again for me. Well, right, immediately it just jams into my hand. So this could be a stability motor control issue. I think it's more so, it's really hard to stabilize her here when you're holding here, right? So let me try it again. Relax for me. Yeah, there it is right there. Yeah, so I'd say that's going to be some mobility dysfunction there because it slams down right away. Right? So if we look back at her then, her ASIS got above her toes, right? Above her toes, her spinal scapula didn't get back. So why was she doing it? Was she going through her hips? Or was she hanging so much on that lower lumbar that that's driving her hips forward, right? That's causing that to happen. So that's with her, that's probably what's going on. Instead of that, the hips being hypermobile, right? Because she's pretty tight that we just saw. So this is probably the culprit coming with that extension that we have to really focus on is right here. And that is your multi-segmental extension breakout.